This morning, Friday, April 17th, the State Department of Health reported that COVID-19 cases in Miami-Dade County surpassed 8,300, and 189 people in our county have succumbed to the virus. Now, while we should still question the reliability of these infection numbers, they are instructive. First, it is unmistakably clear that as to the entire state, our county is far and away the hotspot of Florida, with far more positive infections and deaths than any other region. And our city continues to be a very active area within the county. Second, in our county and city, it seems evident that our efforts have caused the number of new infections to flatline and even decrease. But we are still clearly at risk as the percent of positive test results continues to fluctuate from day to day, which means that people are still being infected and we have not yet reached a peak level of infection. Now, today I wanted to focus on how and when our city plans on reopening. These decisions will ultimately be made by our manager after consultation with our entire commission, as well as the county mayor and governor. So here are my thoughts. We will not be sheltered at home indefinitely. We cannot keep our local businesses closed forever. We will need to get back to work. But how we emerge is trickier for us because we are not a typical city. We have 92,000 residents, many with families and children who enjoy and need access to our parks and public amenities. But we are also a destination city whose beaches, hotels, shops, venues, and restaurants attract hundreds of thousands of visitors, often on a daily basis, many millions on an annual basis, often from all over the nation and world. This pandemic has been beaten back through social distancing and elimination of precisely the kind of large gatherings and crowds that our city was built to foster and promote. So our quandary is, how do we open up a destination city like ours without causing a reemergence and spread of this deadly virus? If many parts of the country and world are beginning to slowly open up, freeing their residents to travel, what happens as thousands flock to our community to frankly do what we typically want them to? How will we moderate the gatherings that will be created, and how will we control the social distancing that will likely still be necessary at some level? Well, the answer is we will do this deliberately and we will not rush into it. And we will rely foremost on science and public health professionals for guidance. Now, you should know we are in close and daily contact with County Mayor Carlos Jimenez, who shares our view that the worst thing we could do is rush into a reopening. He has also made it clear that we will work together to customize the reopening in our city so that it works for us and the region. This can't be a one-size-fits-all approach. There are 9 states with less than 100 COVID-19 cases and more than a dozen counties in Florida that have less than a handful of COVID-19 cases. Their approach will certainly be different than ours. We know once restrictions are loosened countywide, it is likely it will be our beaches, restaurants, and bars that people flock to. So while we are watching what the federal government issues as to guidelines and what directions we receive statewide and in our own county, we may not adopt their schedule exactly. Or we may require certain safeguards that are not necessarily present in other places because of the unique profile of our community. Things like controlling capacity, requiring masks or gloves, testing of workers. So what does that mean with regard to, for instance, the timing of a reopening? Well, we will have to make decisions as more information comes available. But to give you one metric that is instructive, Disney World, whose visitors in many ways resemble the kinds of visitors who regularly come to our city, will not take reservations until early June. The cruise industry has set a date even farther into the summer. But I think you can expect a phased reopening of some things faster than others. One of the first things that will likely happen is that there will be some manner of opening of parks, perhaps with limitations on what activities can happen for a bit. So to my crew who are waiting to restart our weekend basketball game, we may have to wait for a bit. Pools may also be easier or faster to open, as we can control capacity there. Beaches will come back online as well, but only after we have figured out how to prevent throngs of people from amassing. Now, with regard to retail stores and restaurants and hotels, you can expect a gradual opening with clear limitations and requirements to protect against a return of the virus. We have already started reaching out to many of our hotel, retail, and restaurant proprietors who are already, as you would expect, working on developing their best practices within their own technical teams. So let's be clear, all these kinds of openings, whether phased or partial or full, will only happen after the county and state have green-lighted these actions, and only after our healthcare professionals have pressure tested our local approach as a best practice. Importantly, we will have to have in place technical expertise and capacity to guide us. Experts and the CDC have made clear we will need access to much more testing and also have protocols for surveillance testing, isolation procedures, and contact tracing for those who test positive. Unfortunately, I am not convinced at all that there currently exists the capacity and competencies necessary to deliver these essential measures. I know that staying at home is getting old fast. So much of what we love about our community are the things that we can't avail ourselves of right now. And of course, the economic consequences have become their own peril, separate and apart from the health concerns. But nearly 200 people in our county have died. And with many others on ventilators, it is likely that hundreds more will succumb as well. So while this is not a permanent condition, it is a necessary one. For a bit more, we will need to stay the course. As always, thanks for your patience and calm, and stay healthy and, for now, at home.